I was forgetting so many things. Where I put my keys, names I had known for decades, words that disappeared mid-sentence. I thought it was just the stress of everyday life, maybe a rough week, maybe not sleeping well enough. That is what most people tell themselves, and that is exactly what worries me most as a physician. Because if you are taking any of these 7 medications right now, what you are calling stress may not be stress at all. I need you to stop whatever you are doing and watch this until the very end, because what I am about to share with you could be the most important health conversation you have this year. I am not saying this to frighten you unnecessarily. I am saying it because I have seen it happen too many times in my clinic. People who were sharp, funny, independent, and deeply present suddenly becoming someone their own family did not recognize. And when we sat down together and looked at what had changed, the answer was almost always hiding in plain sight. It was sitting right there on their nightstand, inside their pill organizer, in the bottles they opened every single morning without thinking twice, because their doctor told them it was safe, because they had been taking it for years, because it seemed so ordinary, so harmless, so routine. And that is exactly what makes this so dangerous. What I am going to walk you through today is not a conspiracy theory. It is not sensationalism. It is real, documented medicine, research conducted by universities, geriatric specialists, neurologists, and pharmacologists who have been raising these flags for years. I am going to be honest with you about what we know, what we strongly suspect, and where the science is still being debated, because I believe you deserve that kind of respect. I will never invent a statistic to scare you. I will only share what I can genuinely stand behind as a physician. And I promise you, even the documented facts are alarming enough. Let us start with what happens to the aging brain, because this matters before we even get to the medications. As we get older, our brains naturally become more vulnerable. The blood-brain barrier, that protective filter that normally keeps harmful substances out of your brain, becomes more permeable. The liver and kidneys, which are responsible for breaking down and clearing medications from your body, slow down significantly. Enzymes that metabolize drugs become less efficient. The result is that a drug that was perfectly safe for you at 45 may behave completely differently in your body at 65 or 75. It lingers longer. It accumulates. It builds up in tissue that was never designed to handle it in those concentrations. And the brain, which is both incredibly powerful and incredibly delicate, is often the first place where that burden becomes visible. Doctors and researchers use a term called anticholinergic burden. If you have never heard it, write it down. It refers to the cumulative effect of multiple drugs that block a critical neurotransmitter in your brain called acetylcholine. Now here is why that matters. Acetylcholine is one of the primary chemicals your brain uses for memory formation, focused attention, learning, and cognitive processing. It is literally the chemistry of clear thinking. When you block it, even partially, even temporarily, the brain begins to struggle. Memory becomes foggy. Concentration slips, words disappear mid-sentence, and if that blockage happens consistently, over months, over years, the damage may no longer be temporary. Research from universities including the University of Washington and Indiana University has found associations between high anticholinergic drug use and significantly elevated risk of dementia, including Alzheimer's disease. This is not fringe science. This is published peer-reviewed work that is reshaping how geriatricians think about medication for older adults. And the terrifying part? Many of the drugs with the highest anticholinergic load are ones that millions of seniors take every single day without being warned about any of this. So let us go through them. The first one is something you can buy at any grocery store, any pharmacy, any gas station in America without a prescription. It is diphenhydramine, and you probably know it better as Benadryl. It is also the active sleep ingredient in Tylenol PM, Zysquil, Unisom sleep tabs, and dozens of other over-the-counter products. Millions of older adults take it regularly for allergies, for itching, and especially for sleep, because they cannot get a prescription, and this seems like the safer, gentler option. It is not. Diphenhydramine has one of the highest anticholinergic ratings of any drug in common use. A landmark study published in JAMA Internal Medicine found that people who used anticholinergic drugs like diphenhydramine regularly for 3 years or more had a significantly elevated risk of dementia. The researchers were clear. This was not a small effect. And yet this drug is sold in bright, colorful packaging next to the vitamins. And nobody puts a warning on it that says, this medication may be silently damaging your brain. The second pill is something far more commonly prescribed: benzodiazepines. These are the anti-anxiety and sleep medications: Xanax, Valium, Ativan, Klonopin, Restoril. If you are taking any of these daily, this part is critical. Benzodiazepines work by enhancing the effect of a different neurotransmitter called GABA, which slows brain activity. In the short term, that creates calm. Over the long term, particularly in older adults, the picture changes dramatically. Studies published in the British Medical Journal and other major journals have found associations between long-term benzodiazepine use and increased risk of Alzheimer's disease and dementia. One French study involving more than 8,000 people found that those who had taken benzodiazepines were approximately 50 to 60% more likely to develop Alzheimer's disease than those who had not. These drugs also cause falls, which can create head injuries that independently accelerate cognitive decline. I have sat with families who had no idea that the medication their loved one had been on for 15 years to sleep was potentially part of the reason they could no longer remember their grandchildren's names. That conversation never gets easier. The third pill surprises people every single time: proton pump inhibitors, omeprazole, esomeprazole, lansoprazole, pantoprazole, the Prilosec, the Nexiums, the Previcids. These are among the most prescribed drugs in the United States, taken by millions of seniors every morning for acid reflux and heartburn. They seem completely benign. They are sold over the counter. And yet, there is a growing body of research suggesting that long-term use of PPIs may be associated with cognitive decline and increased dementia risk. The mechanism that researchers suspect involves vitamin B12 and magnesium. PPIs reduce stomach acid, and stomach acid is essential for absorbing B12 from food. Long-term PPI users frequently develop B12 deficiency without realizing it, and B12 deficiency, left untreated, causes nerve damage, brain atrophy, and symptoms that are virtually indistinguishable from early dementia. Memory loss, confusion, difficulty concentrating, mood changes. PPIs may also reduce magnesium levels, and magnesium is deeply involved in brain function and neuroprotection. A German study involving over 73,000 participants found that regular PPI users had a significantly higher risk of dementia. The researchers called for further investigation but urged caution, particularly in older adults. If you are on a PPI, I am not telling you to stop it without talking to your doctor, but I am telling you to have that conversation. Ask about B12. Ask how long you actually need to stay on it. I want to pause here because what I am about to tell you next is something many people overlook entirely, and I believe it is costing people their cognitive health, their independence, and ultimately years of quality life. If you are noticing early signs, forgetting words more often, feeling mentally foggy, losing track of conversations, struggling to focus, please understand that those are not just getting older. Those are signals. And signals, when caught early, can be addressed. I want to be direct with you. In the first link in the description below this video, there is a method I recommend to people who are serious about protecting their brain health from the inside out. It addresses memory, concentration, and neurological support using a scientifically grounded, natural approach. I mention it now because what we are about to discuss gets even more serious, and I want you to know that a real solution exists before we go deeper. The window to act is not permanent. Brain damage is progressive, and the longer these risks accumulate without intervention, the harder the road back becomes. Do not wait until you are sitting across from a neurologist wondering how you got there. The fourth pill is one that is specifically prescribed for a quality of life issue that affects an enormous number of older women and some men. Overactive bladder. Medications like oxybutynin, sold as ditropan, and tolterodine, sold as Detrol, are extremely commonly prescribed. They work by, you guessed it, blocking acetylcholine. They are among the highest-rated drugs for anticholinergic burden. And yet millions of people take them daily, sometimes for years, without ever being told that the same mechanism that stops them from running to the bathroom at night might also be slowly impairing their ability to form new memories. A study published in JAMA Internal Medicine found a clear dose-dependent relationship, meaning the more of these drugs people took and the longer they took them, the higher their dementia risk. The brain is not a sealed compartment. What you do to one system affects others, and the urinary system and the nervous system are more connected than most people realize. The fifth pill is one that sits in almost every senior's medicine cabinet: sleep aids. Not Benadryl, which we already covered, but prescription sleep medications like Zolpidem, sold as Ambien, and Isopoqualone, sold as Lunesta. These work on GABA receptors similarly to benzodiazepines, and some research suggests they carry overlapping risks for cognitive function, particularly with long-term use. More directly, they suppress the deep sleep cycles, particularly slow-wave sleep, that the brain depends on to clear out a toxic protein called amyloid beta. You may have heard of amyloid. It is the protein that accumulates in the brains of Alzheimer's patients and is considered one of the hallmarks of the disease. Deep sleep is literally when your brain flushes itself. When these sleep medications chemically suppress that stage, the brain loses its best natural mechanism for protecting itself. You fall asleep faster, yes, but the quality of that sleep may actually be working against the very organ you are trying to rest. If you are watching this right now and recognizing yourself, recognizing a parent or a spouse or someone you love, I want you to stay with me because we are getting to something important. But first, I genuinely want to hear from you. Tell me in the comments, how old are you and where are you watching this from? It matters to me. The people in this community span every state, every background, and knowing who is here helps me bring you more of exactly what you need. If this video is giving you something valuable, something your doctor may never have had time to explain, I want to ask you to please subscribe to this channel and hit that like button. It makes a tremendous difference in helping this information reach the people who need it most. We are building something real here, a community that takes its health seriously and refuses to be left in the dark. Now, the sixth pill. This one is deeply personal for me as a physician, because these are medications I have prescribed myself over the course of my career, and the evolving research on their long-term effects has made me rethink how we approach certain conversations with older patients. I am talking about a subset of antidepressants, specifically the older tricyclic antidepressants like amitriptyline and nortriptyline, and some newer SSRIs like paroxetine, sold as Paxil. Paroxetine has one of the highest anticholinergic ratings among antidepressants. Amitriptyline is even higher. These drugs are genuinely helpful for depression, for neuropathic pain, for anxiety. Depression itself is a significant risk factor for dementia, so this is never a simple calculation. But when older adults take highly anticholinergic antidepressants long-term, the cumulative load on the brain matters. Research from the University of East Anglia found that even a single year of regular anticholinergic antidepressant use was associated with increased dementia risk. The question is never whether to treat depression. The question is whether the specific medication chosen carries an unnecessary cognitive burden when safer alternatives might work just as well. This is a conversation worth having with your doctor. The seventh pill completes our list, and this one is perhaps the most quietly overlooked because it is associated not with a high-profile drug class, but with something that seems almost mundane: acid blockers, specifically H2 blockers, medications like famotidine, sold as Pepcid, and cimetidine, sold as Tagamet. These are different from PPIs, though they share a related purpose: reducing stomach acid. Cimetidine in particular has anticholinergic properties and has been associated in some research with cognitive side effects, particularly confusion and memory impairment in older adults. Famotidine has a better profile, but long-term use of any acid-reducing medication can still contribute to nutritional deficiencies, particularly in B12 and magnesium, that quietly erode cognitive function over time. The recurring theme here is that the brain is downstream from everything: gut health, absorption, nutrient levels, neurotransmitter chemistry. It is all connected, and when you disturb any part of that chain, the brain often pays the price first and shows it last. Now I want to speak to you directly about something that I think gets lost in conversations like this. We talk about what to avoid, what to stop, what to fear, and that part matters. But I also believe deeply in what you can do, what you can actively build in your body and your brain starting today. The brain is not static. It is not a machine that simply wears down and cannot be repaired. The science of neuroplasticity tells us that the brain can grow new connections, protect existing neurons, and recover function when given the right environment. And the nutritional science around brain health has made extraordinary progress in recent years. There are specific nutrients that have been studied for their role in cognitive protection, in memory, in focus, in slowing age-related neurological decline. I am talking about things like lion's mane mushroom, which has been researched for its potential to stimulate nerve growth factor and support neuronal repair. Bacopa monnieri, which has decades of research behind it in the context of memory and learning. Omega-3 fatty acids, DHA in particular, which form the structural backbone of brain cell membranes and are essential for healthy communication between neurons. Phosphatidylserine, a phospholipid that naturally declines with age and is critical for maintaining cell membrane integrity in the brain. Ginkgo biloba, which supports cerebral blood flow. Vitamin B12 and folate, which are essential for protecting the brain against a process called homocysteine accumulation. Elevated homocysteine is independently associated with brain atrophy and dementia risk. Magnesium L-threonate, a specific form of magnesium that has been shown in research to actually cross the blood-brain barrier, which most forms of magnesium cannot do. And lion's mane again, because it deserves to be mentioned twice. It is genuinely one of the most exciting natural substances in the neurological protection space. These are not magic pills, nothing is, but they represent what science-informed, responsible natural support looks like for the aging brain. And the evidence base behind many of them is substantial enough that I discuss them with patients regularly. Here is the thing though, not all supplements are created equal. Not all forms are bioavailable. Not all products contain what they say they contain, or in the amounts that research actually used. This is not a minor detail. This is the difference between taking something that helps you and spending money on something that does nothing. When you are choosing a cognitive support supplement, you need to look for clean labeling, third-party testing, bioavailable forms, and formulations that are actually grounded in the clinical literature. And this brings me to something I want to make sure you do not overlook. In the first link in the description below this video, there is a method I specifically recommend for people who are serious about rebuilding and protecting their brain health, particularly if you or someone you love has been exposed to any of the medications we discussed today. This is not generic advice. This is a complete, structured approach designed for exactly this situation. For people who realize they have been unknowingly accumulating cognitive risk and need a concrete, science-backed path forward. The reality is this: the brain is forgiving in the early stages of damage. It is not forgiving forever. Every month that goes by without addressing this is a month of continued decline. The people who act early are the people who maintain their independence, their memory, their personality, their ability to recognize the faces they love. The people who wait, who say, "I will look into it later," who assume the fog will lift on its own. Many of them do not get that version of later. Please do not let that be you. The link is right there below this video. Click it before you close this page. Let me bring this back to something practical and immediate, because I never want to leave you with only fear. Fear is useful when it motivates you, but it becomes paralyzing when it is not paired with action. So here is what I want you to do today. Concretely, write down every medication you take, prescription and over-the-counter, supplements included. Then I want you to go to your next doctor's appointment with that list and ask one direct question. Is there an anticholinergic burden concern with any of these medications given my age? If your doctor dismisses the question, push back or consider a second opinion from a geriatrician, a doctor who specializes specifically in the care of older adults and who will likely be more familiar with this research. Also, ask about your B12 levels. Ask about your magnesium. Ask how long you are expected to remain on each medication and whether any of them could be tapered or switched to a lower burden alternative. These are not confrontational questions. They are the questions of an engaged, informed patient who has every right to understand what is happening inside their own body. Beyond medications, there are lifestyle factors that the research consistently identifies as powerful for brain protection. Physical movement, even walking 30 minutes a day, has been shown in multiple studies to increase the size of the hippocampus, which is the brain's primary memory center. Deep restorative sleep, real sleep, not sedated unconsciousness, is when the brain clears amyloid and other waste products through a system called the glymphatic network. Social connection reduces dementia risk, possibly because it keeps multiple brain regions active simultaneously. Cognitively stimulating activities, learning something new, reading, puzzles, music, build what researchers call cognitive reserve, which is essentially a buffer that the brain can draw on when disease processes begin. And diet, particularly a Mediterranean or MIND diet, which is rich in leafy greens, berries, fish, olive oil, nuts, and whole grains, has some of the most robust research behind it in the context of Alzheimer's prevention. By this point in our conversation, I hope something has shifted for you. I hope you feel less like a passive patient waiting for whatever comes next and more like someone who understands what is at stake and knows they have choices. Because you do. And that matters more than most people realize. The brain that you wake up with tomorrow is not fixed. It is a living organ, responsive to what you feed it, how you treat it, what you put into your body, and what you take out. The decisions you make in the next days and weeks are genuinely consequential for the next decade of your cognitive life. Before we reach the end, I just want to pause and remind you. If you have been watching this channel and finding value in the information I share, please take a moment to subscribe and make sure you have the bell notification turned on. There is a lot more coming on topics just like this one, and I do not want you to miss it. This community is growing because people are hungry for real medical information that does not talk down to them, and I am committed to showing up for that. Let me close with something I tell every patient who sits in front of me, worried about what is happening to their memory or their thinking. I tell them, the fear you feel right now is information. Your body and your mind are trying to tell you something. Do not mute that signal. Do not normalize it. Do not tell yourself that forgetting words is just aging, or that the fog you feel every afternoon is just stress. Maybe it is, but maybe it is not. And the only thing worse than finding out early is finding out late, when the options are narrower and the road back is longer. You are here. You are watching, you are asking questions. That already puts you ahead. Now take the next step. If any of what we talked about today resonates with you, if you are taking any of these 7 medications, if you have noticed cognitive changes in yourself or someone you love, if you have been looking for a structured way to actually support brain health and reduce dementia risk rather than just hoping for the best, do not leave this page without checking the first link in the description. What is there is not a gimmick. It is not a promise of miracles. It is a real, researched, thoughtfully built approach to what is arguably the most important thing you will ever try to protect: your mind. Take care of your brain. Nobody else can do it for you. I will see you in the next one. If you found this valuable, please hit the like button and subscribe to this channel. And drop your age and where you are watching from in the comments. I read them all, and it truly means something to know who is on the other side of this screen. Thank you for being here.